So I think that there are a number of reasons why we should be concerned about the drop in the number of EU nurses since Brexit. Firstly, they play a key role in our NHS workforce, and our recent work shows that many trusts, particularly those in London and the South East, are heavily reliant on large numbers of EU nurses coming to work with them. Some trusts in London and the South East have up to 20% of their nursing workforce coming from the EU. So any drop or reduction in that supply will affect their safe staffing requirements, but also the level of care that they can provide. The reason this is worrying is because many of these unfilled vacancies left by European nurses will not easily be filled. We know that successive governments have failed to adequately invest in growing a domestic, homegrown supply of British nurses to fill these vacancies. And we know that the prospects for that happening in the short term are not looking particularly optimistic. The government have recently scrapped the nursing bursary, and partly maybe as a result of that, we know that from recent UCAS data, there's been a 20% drop in the number of people applying to study nursing at university. You could argue that we could go to outside of the EU, to countries like India and Philippines, to substitute those, to fill those vacancies left by EU workers. After all, those countries have long provided us with skilled workers in the NHS. But apart from the ethical questions of taking that kind of an approach and the political feasibility of doing that, given that the government remains committed to its net migration target, there's also a big question about how sustainable it is that we keep relying on international recruitment as something of a stopgap for the shortages we face in this country, but also a substitute for proper long-term strategic sustained workforce planning with regard to the NHS workforce, nursing workforce in this country. I think it's also important to remember that Brexit and the subsequent drop in the number of EU nurses registering to work in the UK is just one of many problems facing the nursing workforce. We know that NHS trusts are financially squeezed at the moment. We also know that 1 in 3 nurses are due to retire in the next 10 years. We also know there's a parallel crisis going on in social care, which draws on the same pool of nurses. And we also know that there are increasing healthcare demands being made on the NHS. So whilst it's all very well to talk about Brexit and to focus on Brexit and this 96% drop in EU nurses coming to register to work here, it's important to remember this is just one of many problems facing the nursing workforce. Finally, I think the recent drop is worrying because it may indicate that many nurses simply don't want to come and work in the UK anymore. And if nurses are feeling this way, then it's very likely that other skilled workers such as vets, doctors, IT workers, lawyers may be feeling the same way too. Too often in this country we talk about economic migration as if it's a bit like a tap that we can turn on and off as and when we choose. But that only works if you have sufficient numbers of people wanting to come and work in the UK in the first place. And if that changes and we no longer have people willing to come and work here, then our debates may be characterised more around having too few migrant workers in the UK than having too many.